After my mom passed away, we were going through a devastating loss. I didn't think much about what was going on. And all his stuff started coming in the mail, and I said, "Hey, what's going on?" He said, "I'm moving home to you." I said, "You are?"
Take me home to Allakaket, I think. But I think I'll die in Allakaket. I don't die in Fairbanks.
I said, "Okay." I never questioned him after that.
I had an elder tell me, our souls don't rest unless we're able to die at home. When we first started, elders would be receiving no care, and sometimes their conditions were horrific. Or they were transferred to Fairbanks and Anchorage and put into assisted living homes or nursing homes. And in some of those places, it is like a total different world. They don't speak your language, they don't look like you, they don't eat the same foods. Family can't visit, the cost is too much, and once you get there, you have to pay for hotel and meals. So having them out there is so depressing and demeaning to them. You just can't have it that way.
We really honor our home community-based services program, whether it's personal care attendant services, any kind of home care services. We want to do everything we have to do in order for them to age in their communities.
Well, the family is the first support, so we provide case management and support to the family caregivers and to the communities.
They call and ask, "Is there anything that your dad needs, the elder food box or travel for his appointments?"
Our case managers and our nurse travel to each community twice a year so that they can do a visual assessment of the elder. They can also see the condition of their home, provide them with home safety assessment.
You get up and down okay from your couch and like in the bed?
Uh-huh.
Do you have difficulty at all?
No.
No? Okay. Pain anywhere? Like back pain, leg pain?
I'm sure, but who could try?
The prevention coordinators go to people's homes too, and they focus a lot on just the safety issues, fall prevention, medication management. They have funding to help with buying equipment to make the home safer.
Do you take medication?
Oh yeah.
What kind of meds are you on?
empty.
The personal care attendants focus on the personal care needs of the elder, like bathing, feeding, grooming, cooking meals as part of the chore, as well as hauling water, shoveling some snow.
Then, as the elder progressively gets worse, they need a break. So we do respite care. Because it does get wearing on a family member. Because they're the main support, we don't want them to get burnt out.
One of the biggest challenges we have is hiring people in the village. There's a lot of criteria that they need to meet, background checks, fingerprinting. They need to be trained in first aid and CPR. And then just the whole challenge of long distance supervision.
The cost of me traveling out is huge. You have to find somebody in that community to provide the services. Otherwise, they're not going to get any services. The funding comes from 2 small state grants, and that's to provide case management and support to the family caregiver, including respite, and then senior in-home, which provides some care coordination and chore services to elders. We got a seed money from Alaska Mental Health Trust to restart the PCA program. Tribally targeted case management is going to allow us to bill Medicaid for the care coordination that we provide now and aren't reimbursed for.
It's really a cost savings to the state of Alaska. When you think about the continuum of care Community-based services, maybe $20,000, $30,000 a year. Nursing home costs or institutional costs, $110,000 plus a year. It makes sense to really honor care, which honors their ability to remain within their community. It's much more dignified.
It's a good program. We're still in our home, but we need help.
We're all willing to share our information and our knowledge that we have to help get a program started.
I think the beauty of working with TCC and with Cindy Nation is that we agree to disagree at times. It's a partnership, and I'm confident that as we go forward, we're going to make change for the better.
We treasure our elders. That's part of our culture. They bring a peace and a calmness to us, and they also are our wisdom keepers.
The elders would rather live around where they grew up than be in their comfort zone.
My wife, she told me, Daddy, I'm going to have to leave first, she said. I said, well, why? I don't want to be poor behind you, she told me. How about me? I said, oh, you'll be strong, Daddy, when I leave. So I'm strong. That's why I'm here with my kids and my grandchildren and my people. All my grandchildren, like all of you, I'm here.